Welcome to the Elder Care Network webinar series. This is Jonathan Bryant, and I'm excited today of something that we've probably done more marketing and anticipation for because joining me from Sensiva Health is Heather Hutson, who is the Chief Infection Prevention Officer. And I'm enunciating on purpose because that's the first time I've been able to say that without tripping over my words. To give you a little bit of background, Heather has worked alongside public health departments to develop best practices, educational webinars, presented at numerous healthcare associations, conferences, and she's been featured on many healthcare-related podcasts. She's a member of NADONA, the Arkansas Nursing Home Nurses Association, and nominee of the Arkansas Director of Nursing of the Year in 2019. She is a board-certified infection preventionist, as well as a dementia well-being specialist. And I don't know if I've ever heard that one before. And is also a CPR and first aid instructor. And so she is going to be joining us today to be able to talk about, yes, infection prevention. So pay attention. And if you're not joining us live, and I'm going to start admitting people now, then please feel free to reach out, and we'll have a way to be able to get in touch with Heather and Ben at the end of this call. But without further ado, Heather, thank you so much for joining. I'm going to take a lot of notes here. I'm excited to have you with us, and thanks for presenting to your peers today.
Yeah, thank you. I appreciate the introduction. I'm going to jump right in. This is a topic that makes me really excited. So hopefully today we'll give you some good information. The title of this presentation is Empowering Long-Term Care Strategies for Managing Infection Outbreaks. So today we're just going to discuss why infection prevention and control in long-term care is so challenging, and how to overcome those challenges by implementing a comprehensive strategy that includes antimicrobial stewardship, molecular diagnostics, technology solutions, and also how to incorporate staff empowerment. So first, we're going to talk about really getting a good understanding of what is so challenging about infection prevention and control and how to overcome some of those challenges. So usually one of the first things that I hear from facilities is regulations are so challenging and difficult for facilities. And as a former director of nursing, I completely understand that. The infection control regulations for long-term care facilities are found under Title 42, Section 483.80 of the Code of Federal Regulations. In long-term care, we often are more familiar with the deficiencies or F tags that a facility could receive for noncompliance with regulations. So F880 through F888 are deficiencies that state surveyors could cite a facility with noncompliance if noncompliance is determined. So F880 is the one that we hear most common, and this has been one of the most commonly cited F tags for years. It states that facilities must establish and maintain an infection prevention and control program that's designed to provide a safe, sanitary, and comfortable environment for the residents. It must include a system of surveillance that is designed to identify possible communicable diseases or infections before they can spread to other persons in the facility. So I see a lot of facilities that don't have an infection prevention and control program implemented even today. This regulation was to go into effect in November of 2019. And then 2020, we had COVID, so everything was kind of put on hold. But even now in 2024, I'm still seeing facilities that are receiving citations for not having a complete program put into place. And I'm going to get into why in a few minutes, but mainly I feel like this is because a lot of facilities don't truly understand that one of the main parts of this program is to prevent infections. So very often I see that the programs are not preventing infections and outbreaks. They're just controlling what they already know to be there. So a lot of these facilities that I've worked with in the past have a program, but their program is reactive and not proactive. So they're kind of stuck in a cycle of controlling what they already know to be there, and they're not actually preventing infections before they occur. And as I read on the previous slide, that is a very important part of your infection prevention and control program. And that's because the geriatric population that we care for in long-term care are very vulnerable. So we have to shift our focus and make sure that the IPCP is preventing and controlling and not just controlling. So we have to make sure it's proactive. And this is why it matters. So here's just a few of the many statistics that are out there that really underscore the importance of implementing a robust infection prevention and control program in long-term care. And this is obviously to protect the health and safety of residents and staff. So just to go over a few of these, there are about 380,000 deaths in long-term care facilities per year. And of these deaths, there's also 2.8 million infections in long-term care facilities per year. 30% of the infections in nursing homes are urinary tract infections. And then 40% of COVID-19 deaths were nursing home residents. And I think we all remember seeing that all over social media and the news. 50% of residents with infections in long-term care facilities will be hospitalized from these infections. And overall, infections have been the leading cause of hospitalizations and deaths among nursing home residents every year. So that is just, like I said, there's a lot more statistics out there, but these are just some that stuck out to me to kind of relate to why prevention matters so much. So we know that there's going to be challenges there that long-term care facilities are going to face. As I mentioned, regulations are one of the big challenges. Staffing issues are another challenge. But really, to effectively prepare for challenges related to these outbreaks, we have to implement a comprehensive strategy. So a strategy that I found that's very effective in long-term care facilities incorporates a combination of different tools, is what I call it. So this approach that I have seen to be extremely effective in long-term care facilities includes antimicrobial stewardship, molecular diagnostics, technology, and staff empowerment. So we're going to jump into that real quick. And first, we're going to go over antimicrobial stewardship. So a lot of facilities ask me, whenever I go into a facility, I'll ask them to see their antibiotic stewardship program or antimicrobial stewardship program. And a lot of times they give me a list, and it's just a line list that has their residents' names on it and the antibiotics that they are currently on or have been on in the past. A lot of facilities refer to this as their line list, and this is a very important part of the antibiotic or antimicrobial stewardship program. But the goal of this program is more than just tracking antibiotics. This is more of a reactive approach instead of proactive. We already know that these residents are on antibiotics, but what have we done to prevent them from getting the infection that requires an antibiotic? So one thing that I tell facilities is that the antimicrobial stewardship is a systematic approach that's used to optimize the use of antimicrobial agents. And these agents are antibiotics, antivirals, and antifungals. And that's why I like to refer to it as an antimicrobial stewardship program and not just an antibiotic stewardship program. But this approach is to ensure the best possible outcomes for residents while also reducing the risk for antimicrobial resistance, which we see, it's on the rise more every single day. So that's something that we really need to get a hold of, so it doesn't affect the residents like it has in the past. So antimicrobial stewardship begins with prevention. So we really have to monitor the residents' symptoms and their well-being before they're put on antibiotics. And this is why, just a few more statistics that I found, 40% of the deaths of antimicrobial resistant deaths occur in adults over 65. 70% of nursing home residents receive antibiotics every year, and that's a lot. 75% of antibiotics are prescribed incorrectly. So they're given, I saw this all the time. Maybe they're given an antibiotic for what the diagnosis is upper respiratory infection, but actually it's a viral pathogen and an antibiotic's not needed at all. And then 1.27 million deaths per year occur due to antimicrobial resistance. And, like I said, there's a lot more statistics that are out there. But this is just, a little glimpse of why antimicrobial stewardship is such an important part of the infection prevention and control program. So another question that I get asked so often is, well, where do I start? They give me the line list and I'm like, this is great. I'm glad that you have this, but there's so much more to it. So when I get asked this by the infection preventionists at the facility or the leadership, here's just a simple guideline that I offer to facilities. The symptoms, documentation, criteria, and need is a good guide to follow. So symptoms, and this is the first initial sign, not a fever or the need to send a resident to the hospital. And one way that I found as a director of nursing that was very beneficial was to get all the staff involved in this part. I really relied heavily on my environmental staff for this. And one thing that I did was I pulled all the housekeepers to the side and I said, I need you guys to tell me if one of our residents is, using more tissues than they usually did. That's a really good indication. The very earliest sign that a resident may have, symptoms of a respiratory infection, a viral infection, or what have you, that is starting. So at that moment, whenever we see that, a housekeeper reports to the nurse or the DON or the infection preventionist, hey, usually Miss Jones down on 100 Hall, I'll restock her tissues once a week, but I've already done it 2 or 3 times this week. She's going through a lot, or we see, whenever I took out her trash, she had a lot of tissues in there. Like, this matters. And your housekeepers need to know that this is an important part of their job and their role in preventing infections. So at that point, and that's just one example, there's a lot of other things that, we can pull all the staff in and different ways that they can be aware of their role in preventing infections. But that's just one thing that I did that was very effective. And at that point, whenever they relay this information, let's say to the nurse on that hallway, her documentation should start immediately right there. And, a lot of nurses, whenever I, tell them this story, they're like, you want us to chart that the resident's using a lot of tissues? Absolutely, I did. And I think that it's a good practice. And the reason for that is your documentation paints a picture. So when the provider goes back and sees when did the symptoms start, so often I see that the very first symptom is documented the day that the antibiotic is prescribed. And that's not soon enough, because the symptoms started way before the antibiotic was needed, way before we picked up the phone to call the provider to ask for, diagnostic testing or what have you, or, the need to send them to the hospital. So the documentation should start at the very earliest indication that something is changing with the resident, even if it is something as simple as an additional box of tissues. So then after we start that documentation, every shift from then on out should be getting vital signs on that resident. They should, go in and do assessments of whatever the system is, whether it's respiratory or urinary or, GI, whatever the system is. We should really pay close attention to that system and get really good, clear documentation. After that, the criteria. So a part of the regulations with infection prevention and control program says that every facility should adopt a criteria to be utilized for antibiotic prescribing. So a lot of facilities use McGear's criteria. I see that more often than anything. But what I also see is that they'll have a piece of paper in their program. Usually it's a binder, and it just says that, our facility has adopted McGear's criteria. And if I ask a nurse or the provider about this criteria, what criteria does your facility use? They typically have no idea what I'm talking about. So it's great that you have it written down and documented. So, when state comes in, they can check the box saying that you're in compliance with that part of the regulation. But what's so important is to make sure that it's known by all the staff, not just the nurses, but all the staff and the providers. The providers need to understand and be on the same page with that as well. So after, you have the symptoms started, documentation is initiated, make sure the criteria is met. McGear's criteria is great. It gives you all the guidance that you need and, step by step for each system, what to do next. But after that, one thing that I really see is, is there actually a need for antibiotics? And I think that in long-term care facilities, we're so quick to call the doctor and ask for antibiotics because it's a very vulnerable, population. We know this, they can change within hours. But I always ask my nurses, before you call the doctor, really evaluate the resident, the documentation, and ask yourself, is there a need for antibiotics? What am I calling the provider for to ask? Know what you want before you call the physician. And the reason I say this is because, like I said before, if you have a resident that has symptoms of what we typically consider an upper respiratory tract infection, is it allergies or is it viral? So there's other tests that can be administered to a resident to find out exactly what that resident has so the physician can tailor the treatment for the pathogen that's causing the symptoms. So a lot of time, I have experience with this, there was a really hard lesson that I learned. We had 17 residents that were on antibiotics for upper respiratory tract infections. And we implemented molecular diagnostic testing in my facility. We did PCR swabs of these residents. And we found out that only 3 of those residents actually needed antibiotics. Wow. Now, if the antibiotics would have been effective, if you will, on documentation on paper after the viral pathogen ran its course. But, what you run into the risk of if antibiotics are prescribed when they're not actually needed is C. diff, antibiotic resistance. So many other issues can happen to the resident if an antibiotic is not truly needed. So just make sure that whenever you're before you pick up the phone to call the doctor to go over the symptoms, over the issues the resident's facing, already in the back of your mind know what your actual ask is. What does the resident need? Does the resident need more tests? And a lot of times, if you let the provider know exactly what you think that the resident needs, it's highly unlikely that they're going to go against what the nurse is recommending. It's not that you're, stepping on anyone's toes. It's just, hey, do you think that we could get additional testing to see if this resident has a viral pathogen or actually needs an antibiotic? So that's something that I highly recommend, is really making sure that you have good communication with your provider and making sure everyone's on the same page, and just to know what you need before you call. And, I just talked about molecular diagnostics a little bit, and that's the next topic. And a lot of times whenever I mention molecular diagnostics to facilities, they automatically think PCR testing for COVID. Well, there's been so much improvement there, and molecular diagnostics goes way beyond, a swab in the nose for COVID. And this is something that I see a lot of facilities kind of shy away from because they don't truly understand how beneficial it is for the resident. So unlike traditional culture-based methods, which rely on the growth of microorganisms in a culture media, molecular diagnostics directly detect the genetic material of pathogens that are present in the clinical sample. So this approach offers so many advantages to the resident in a long-term care facility. And just a couple that I want to mention are, increased sensitivity and rapid turnaround time. They really give us the ability to detect non-viable or fastidious pathogens in the resident. So when we integrate diagnostic testing into infection prevention and control programs, it's essential for effective outbreak management in long-term care facilities. So the early identification of cases through diagnostic testing really enables healthcare providers to initiate that timely intervention that's so needed for this vulnerable population. It also allows the staff to implement appropriate infection control measures and to really contain the outbreak before they escalate. So, really by incorporating this molecular diagnostic test, I already mentioned the rapid and accurate results, improved patient outcomes. We also minimize the use of antibiotics. And I've, already mentioned that a few times before. Is it a viral pathogen? Does it actually need antibiotics? But also, one thing that I also want to mention is, the effective infection control. So, molecular diagnostic testing can absolutely be used for respiratory infections, but it can also be used for urinary tract infections. A lot of times, where I was the DON at, we lived, or our facility was 30 minutes away from the closest hospital. Well, our labs were even further away than that. So if we had a resident that, met the criteria to get, and the physician ordered a urinalysis with the culture and sensitivity, sometimes it could be 7 to 10 days. Typically it was, 3 to 5 days, but after the results came in, they'd already probably had a urinary tract infection for over a week. And, typically what the physician would do would order a broad spectrum antibiotic, go ahead and get them started on this antibiotic that's broad spectrum, should treat anything that's common. And then they would order the culture and sensitivity. Well, typically whenever the results would come in, the antibiotic would need to be changed. So they've been on an antibiotic that was, ineffective for several days. And then they're put on another antibiotic. So the treatment's just delayed. It's just drawn out and it's unnecessary. A lot of times those residents get put in the hospital and become septic. So with molecular diagnostic, if your physician orders a molecular urinalysis, the results could be available within 24 hours. So in this case, with residents that are this vulnerable, it's just a good tool to have to be able to use on these residents, so your results come in a lot quicker. Also, if your resident does have, a wound, and let's say that, we get a PCR test on that and we get the results within 24 hours, we can really control and understand how to manage whatever that resident has. If they have a wound, it has to be covered. But also, there are certain pathogens in facilities that the resident has to be on isolation. So the quicker we know that, the better chances of really containing that pathogen and preventing an outbreak. The chances just increase. So it also enables us to enhance surveillance. And surveillance is something that a lot of facilities struggle with, because there's, a couple types of surveillance. One is just looking at the data, and one is looking at your processes. So if we get a resident that has a urinary tract infection with, a specific type of pathogen, and then a couple of days later, we have a resident that on the same hall, their roommate or what have you, that also is positive for a urinary tract infection with the same pathogen, let's just say E. coli, good chances are we need to look at we need to do some surveillance to look at our processes. We may need to do some more training on pericare or what have you. So it's just a good way to really get things under control quicker by utilizing the molecular diagnostics. And I've already gone over this, but just to really reiterate it, the importance of rapid results due to the vulnerability of the geriatric population, molecular diagnostics are crucial for providers in long-term care settings to quickly and accurately detect pathogens so they can tailor treatment strategies and prevent the spread of infections. This results in improved patient outcomes and effective infection control. All right, technology solutions. There's a lot of data out there in long-term care facilities. And a lot of times facilities have all this information and they don't know how to make it useful. So by incorporating technology into the constantly changing healthcare landscape that we're in today, it can really it can be extremely beneficial to fight against infection outbreaks, especially in long-term care facilities. So here's some ways that we can really leverage technology to streamline infection controls. And tracking, analysis, documentation, reporting, education, population awareness. These are just a few ways that taking technology and really leveraging it can help us with all of our initiatives with infection prevention and control. When we have these tools like advanced technology, or when we have the advanced technology tools like the real-time tracking systems, so we know exactly where, with a laboratory, if you have a laboratory that has this real-time tracking, we can always know where the sample is. So we can get a good understanding of, how soon our sample is going to be resulted. How soon can we get treatment, if needed, started on our resident? Also, data analysis. Like I mentioned a few minutes ago, there's a lot of data out there. And one thing that is sometimes difficult, especially for new infection preventionists, is what do I do with all the data? So by using this technology that is incorporated, I'll just say, into our laboratory, it's extremely beneficial for that, especially a new infection preventionist. but also with the molecular diagnostics that are integrated with facilities' electronic health records. It's just one more step that is taken off the, the desk or the lap of the infection preventionist. Also, quick and accurate reporting. I've already talked about how vulnerable the geriatric population is. So having it be, your reporting coming back quicker and making sure that it's very accurate, it's very important. Also, the patient population awareness. So that's also extremely important to have a good understanding, not only from resident specific, but what's going on in the whole facility. So like a month by month report of exactly where you are, where you stand, how you've improved month to month is extremely beneficial for the facilities. So yeah, technology is just another tool that I've seen that's very effective to enhance your infection control efforts. And by integrating these technologies into the infection prevention and control program, long-term care facilities can ensure timely interventions, accurate diagnosis, efficient data management, proactive monitoring, and all this ultimately just increases and safeguards the health and well-being of your resident. Okay, so empowering staff is extremely critical. It's a component that we could really utilize to fight against infection outbreaks in long-term care facilities. And, I've talked to a lot of facilities about this, really truly understanding what empowerment is and how you can use it to increase your infection control efforts. And just a simple definition of empowerment is it's the result of ongoing and continued support, authority to implement or adjust programs, having access to needed tools and resources, and recognition for their efforts. So as a former infection preventionist at a long-term care facility, one thing that I noticed was there wasn't a lot of access to education and resources and, things that I felt that I needed. I had the title of the infection preventionist. I was the DON/infection preventionist at my facility. But whenever it came to, implementing different portions of the program or making adjustments that I thought were needed, I was always told that I needed to run everything through my nurse consultant. So whatever the policy is at your facility, definitely follow it. But one thing that I always suggest to leadership is that if you're going to give someone the title of infection preventionist at your facility, then they should at least have a little bit of authority to implement and adjust programs. If the IP feels the need to increase the audits of hand hygiene because she feels that they're having issues, I feel like there should be a little leeway there where they should have the authority to adjust those types of programs and audits. They should also have continued and ongoing support from all the staff. As I think I mentioned this before, infection prevention and control touches all departments, everyone in a facility, every department. It's not just nursing. There's a lot of pressure put on the nursing department, but really to have an effective program, every department, every person is involved. So with that being said, sometimes the infection preventionist may need to go into the dietary department and make recommendations. And the leadership at the facility really needs to make sure that they're supported. If they need to go to another department and make recommendations, that teamwork is extremely important to make sure that the program is effective. And another thing that I always stress to leadership at facilities is making sure that they're recognized for their efforts. And just a quick funny story. I told this to an administrator before, because the infection preventionist made a comment, well, I'm just the IP. What does it matter what I say? And it just, kind of struck a chord that, she's not getting any recognition. I could tell that she had, a heart for this and she really wanted to see improvements. And I felt that she was doing a good job. So I just casually mentioned it to the administrator, and she said, well, what should I do, hug her? And I said, no, if you want to, that's fine, but that's not what I mean. I don't mean that you have to, go around hugging your staff unless you want to. But what I mean by that is to make sure, month to month, if you see a decrease in infections, if we're seeing a reduction in antibiotic usage, then the infection preventionist and the housekeepers that were involved and the nurses that were involved, everyone needs a little pat on the back, whether that be an announcement, hey, good job, guys, you are doing great, keep it up. If your staff is not hearing that they're doing a good job, they're probably not going to continue doing what they're doing. And I think that that's just common practice, not only in long-term care, but everywhere. We have to make sure that the information is known. So, a lot of facilities have, monthly meetings where they're going over this information. And if we see a win, if we see a reduction in infection control or infections where our infection control measures are effective, we've implemented new policies and the CNAs are, increasing hydration or, whatever the situation is, we have to let them know that their efforts are working. I think that's extremely important. Also, I see a lot of facilities, their focus is on surveys. So, and there's definitely a lot of pressure felt in long-term care facilities to make sure that, that long list of government mandated requirements, all the, deficiencies, all the regulations are met so we don't receive deficiencies. And it's very exhausting. It can lead to a lot of anxiety, not only for the leadership, but also the staff. So a lot of times I encourage leaderships to really change their focus. And I say this because as a new DON, I was in my early 20s and I would have in-services with my staff. And a lot of times I would, implement a new procedure, or we need to change the way that we're, doing this, or whatever the case was. And I always ended it with, because we'll receive a tag if we don't. We're in our window for survey, so we have to do this. We have to be better because we'll get a tag. Well, I found out real quick that the only person in that room that really cared about whether the facility received a citation or not was me. But whenever I changed my focus, where it wasn't just because of, a possible citation or whatever, instead, I ended it with, because it's better for the residents this way, or because if we do it this way, you have a reduced risk of taking pathogens home to your family and spreading it around the facility. Then the compliance increased. So I really think that, a lot of facilities need to take a step back and make sure that the information that they're presenting to their staff is not just based on being survey ready, but being ready every single day and doing the right thing, because the resident matters and they need you to do the right thing every single day, not just because you're in your window for survey. I really think that that's a part of empowering your staff, and not just focusing on survey readiness. A lot of times this takes changing the culture. And, I've said it before, but it starts with leadership. We can, all day long, we can, say we're going to change our culture. We're going to implement, we're going to have a culture that, is all about the residents and, all about infection prevention and control. Like, we're really going to do, good by our residents. But until the staff sees buy-in on the top level from the leadership, it's not going to change. It should start at the top and trickle down. So one thing that is extremely effective in changing your culture to make sure that infection prevention and control is a priority is communication. So I had an open door policy. I know a lot of DONs do, a lot of administrators do. I think that's wonderful. I wasn't in my office a lot as director of nursing. I was on the floor with my staff. And one thing that was extremely important to me was to make sure that the staff felt comfortable to communicate with me and the residents and the family. And I think this is extremely important in any kind of culture that really fosters, infection prevention and control. Making sure that if a CNA down the hall says, hey, I don't really understand why, this resident is on isolation. Why, if they have a urinary tract infection, but they are, continent, why are they on isolation? But, to make sure that they are comfortable with asking you those questions, because there could come a day where they don't, if you don't have a good culture that has open communication, that they may have a question that's very important, and instead of asking you, they just do it their own way. Maybe they don't understand why, I don't know, why hand hygiene is important and why you should, if a resident has C. diff, why they have to wash their hands and, antibiotic hand sanitizer, or I'm sorry, alcohol, hand rub's not effective. They need to be able to ask you these questions so they get it right every time. So definitely making sure you have open communication, but also consistency. And this kind of goes back to changing your focus, not just being so focused on survey, but every day, making sure that if your nurses are down the hall and they see something that could be, an infection control issue, that they're stopping it right then. If your CNAs are, doing pericare on a resident, and, you have 2 CNAs that are, providing pericare, and one CNA sees that another one has missed a step, like, we should be consistent in all areas to make sure that everyone has that good open communication to be able to say, hey, we got to do it this way. If we don't do it this way, then this could happen. So anyways, I think that it's extremely important to be consistent. But yeah, staff empowerment is extremely important in our facilities to make sure that our empowered staff are way more likely to adhere to best practices. And they're also a lot more, they're a lot more prone to follow those best practices and address a potential infection risk quicker than if they're not. So, in conclusion, the benefits of implementing a proactive infection prevention and control program that incorporates the antimicrobial stewardship, molecular diagnostics, technology, and staff empowerment go far beyond just compliance with regulations. They also contribute to the reduction of infection rates, multi-drug resistant organisms, cost, hospitalizations, and staff burnout. And, with that, I do thank you all for joining in. And I do want to take a second to introduce Ben Williamson with Sensiva Health. He is here with us today, and he's just going to say a few things about our company.
Thanks, Heather. Yeah, first and foremost, I want to thank everybody for joining us on this webinar. And I especially want to thank Jonathan for welcoming Heather into the group and allowing her to come share all of her knowledge today. Obviously, knowledge is power, and a lot of this is so much, it revolves so much around education, more so than it does around anything else. And I think we've all learned a lot today from what Heather has had to share with us, both from, an experience level, but also her education. And, I think the goal of this webinar wasn't to end by trying to sell anybody anything. Our goal is always education and advancement of overall patient care. I think, Jonathan, that's your goal. That's Heather's goal. That's been my goal all along. And it's one of the things that Heather and I connected on when we first met almost 5 years ago. And, all that to say, I think this is and can be a bit overwhelming at times. And we also understand that every facility is at a different stage in their infection control and prevention programs. And I just want to say that Sensiva, myself and Heather, we're all here to help, whether it be big or small, a quick phone call to answer your questions, assess your needs, or a full-blown practice analysis. I mean, please don't be shy. Reach out to us. Heather and I are very eager to get involved. No facility is too small, and no facility network is too big. We work with onesie twosies all over the country. We're licensed in all 50 states. We're Medicare credentialed, and we like to think we do things the right way by manufacturing all of our own diagnostic kits in-house, all of our customer support in-house, all of our technology in-house, and a centralized lab in the middle of the country so that we can get you results back as quickly as humanly possible. But all that to say, Heather's information is at the end of this slide. We'll make sure we provide the additional materials so that, if somebody's out there that wants to chew through something a little bit quicker than watch this entire presentation, it'll be there. But beyond everything else, we hope you found something that you could take away from this, and we hope it was beneficial.
Thank you, Ben. So, Heather, this is really important stuff, and thank you for sharing some wisdom with us. My takeaway, more than anything from what I've learned today, which is a couple pages worth of notes, but we have the ability as care providers to focus on the things that we can control. And I'd say about 95% of what I heard from Heather today is within our control at the community level. Empowering your staff, setting the right expectations of from leadership. Look, you don't have to care about seniors. You can just care about the economics. And if you know that 50% of these infected are going to be, require hospitalization, that's money out of your pocket, right? Whether it's a skilled nursing or it's an independent living or CCRC. In every one of those cases, you're losing money by not having a protocol. And furthermore, Heather, I love the point about within staff empowerment where you're talking about recognition. Look, if you just did dollars and cents, and I'm a man of average intelligence as a business owner, but I have some KPIs that I know of how my company will make money. And if you look at what the lost revenue, the costs of getting dinged in survey, these things, that is so much more expensive than an incentive for your staff, the recognition involved, gifting to, and the pride in their work. One of the things you didn't mention, Heather, is what's the likelihood that that nurse is going to stay there if she's not empowered and she's not recognized for great infection, prevention. So all of these things are so very important, not to mention the most important thing, and that's the health of our seniors. There's so many things that you've mentioned here that are absolutely within your control. And as a whole, guys, Ben hit the nail on the head. You guys all know that if you've been to any of these webinar series, or if you've ever posted anything in the group that has been purely solicitation based, it doesn't pass the filter. I take a lot of pride and responsibility as your servant here to make sure that we have peers like Heather and Ben here to educate you and take things that can be immediately implemented in your building, in the home, that can make dramatic effects to your business as well as the care of elders. And I'm very grateful for you guys sharing this. And I won't mention, because Heather's information is right here, I implore you, reach out, and any documentation in addition to this recorded webinar that will be in the Sensiva Health folder under the webinar series, please check it out. After just kind of setting this and then delaying this webinar, I've had dialogue with Ben and Heather for a couple of months now. This is purely from the heart, and these are resources that you really can take to heart. And boy, if you have questions, they're not, this wasn't a sales pitch. This is just really good ideas that you can simply, things that you can do in a building that really make a monumental difference. And I'm going to skip the rest for respect of brevity. But guys, thank you so much. I really appreciate it. And I'd be very interested to be able to have you back here in between, like maybe say 6 months and a year, because I'd be really interested, Heather, to be able to see what the data shows us of how, look, resistance to antibiotics is real. I was going to ask you a question. I'll ask it off air, of chicken or the egg, right? Who ultimately is responsible for misdiagnoses and not using an antiviral instead of an antibiotic? Which obviously we're talking about an aging population that is that doesn't have the natural defenses anymore to recover from these things. This is really critical information. But just in closing, thank you guys. Thank you, Sensiva Health, for being here today. I really excited that we were able to fill this gap, because we'd never had anybody talk about this extremely important topic. And well, I tell you, even if it's just for what you've given us today, I wish for your success, and hope Sensiva can be able to join us again and share some of the data. And boy, I hope we're in an upward trajectory as far as what that data shows. These are pretty scary numbers.
Absolutely.
All right.
Thank you, Jonathan.
Thank you.
Thank you, guys. Appreciate it. And again, reach out to these guys if you have any questions at all. Really delighted that you guys joined us, and best wishes, everybody.
Thanks.